Hello, everybody. How are we doing? And welcome to the webinar. I'm just giving it like a couple of more minutes and then we can start. I would like to welcome everybody at the outset. I'm just waiting. Hey, Jonathan, can you hear us?
I can, yes.
Okay. All right. Would you mind switching on your camera, Jonathan? Cannot see you
Yep,
still.
I'm working on it. Teams always has issues. I'll just use my phone for now.
Oh, okay.
There we go.
Okay. Looks like we have a presenter missing. I hope that Ramesh joins in the meanwhile. Let's get started because I think we're already 5 minutes above the timeline that we had. So, welcome everybody. I'm here. I'm Hemant, and first of all, I would like to thanks everyone who has joined the call today for this webinar that we would conduct today. The topic today is very interesting, and I'm very excited to have this panel with me today. They are all highly celebrated and good experienced people coming from the technology and digital health solutions in their different facets of life. So thank you to all my presenters and thank you to all my panelists today. And today's topic we're going to be talking about is very interesting as well. Transforming patient care with digital health solutions and AI. Um, as we've all seen, we've all gone through these patient care cycles in our own lives. And in the past, I don't know about others, but in the past, I've seen in the past 5 to 10 years, the way the patient care has been delivered has completely changed and transformed. And I found it very fascinating to talk about this topic today. We do these webinars as at least once a quarter, so I welcome everybody who is joining us today for the first time to please feel free to join us in the next events as well. And we will get started. The agenda today would be simple. We would start by discussing various topics around digital health. And then we will slowly move to the case studies of all the presenters on how we are contributing to the digital health solutions in the market. And then we will take the question and answers from the audience. And for the question and answers in the end, I would really appreciate if you can just put the question and questions that you want to answer to the panelist in the chat, and then I would be asking those questions from the panel. If you want a specific person to answer that question, please feel free to put the name of the panelist that you want to ask, and we will take it from there. So, without further ado, I would start by inviting all my panelists along with me and brief introduction about me. So I've been an entrepreneur for the past over 20 years. Started my first company in 2002 in India, and then I moved to US in 2015. So almost 9 years now in US. And what I have been doing is we provide digital solutions under a brand called Jump Growth, where we help various companies and businesses in engineering the products, software products, and software technology to enable and help their businesses in any way we can. Healthcare being one of the major sectors that we have that we focus on. We are very excited to hold this webinar today on the topic of healthcare. And that being said, I would like to also invite Jonathan. Jonathan Govett, he is the CEO of Oatmeal Health. I'll give the mic to Jonathan to give a brief introduction to by himself. I think let the man speak himself. So, Jonathan, over to you.
Pleasure. Nice to meet everybody. Real high level CEO of Oatmeal Health. My previous life, I started a company called Referral MD, which was a care coordination platform for hospital systems. Engineer by trade on the front end, been building software for almost 20 years, all in healthcare. little funny, fun topic. Was going to become a doctor at one point in my life and decided against it just because I have better skills in the engineering side of things. Fast forward to our company, Oatmeal Health. We are one of the first virtual cancer clinics in the country that specifically works with federally qualified health centers. It's called acronym FQHC. A lot of people don't know there are nonprofit entities that service about 32 million patients around the country under the Medicare and Medicaid program. So high level, we do lung cancer screening and soon to be breast and other disease states, going into the clinical trial space as well, ensuring that our patients get the best care possible. I'll go into more depth later. Thank you.
Thank you, Jonathan, and welcome to the event. And thanks for agreeing to be as a panelist today. Moving to Ramesh. Ramesh, we cannot see you, but I see that you're in the panel now. Can you unmute yourself? And if you don't mind, please give a small introduction about yourself.
Thank you, Hemant, and thank you to all the other speakers. My name is Ramesh Kumar. I'm CEO, co-founder of Zaki Point Health. We help third-party administrators, healthcare administrators, to manage the employers, self-funded employers' healthcare risks and costs by providing a price transparency tool, a better way to navigate the patients, and to really personalize the patient experience so that they know what's high quality, low cost place of care. What got me excited with this journey is I was helping my dad to be healthier, helping him to stay on course with his wellness program, and found that it's very difficult to change people's behavior. You cannot really change that overnight. But through that journey, I was able to help him see that he could have saved money on healthcare, particularly on pharmacy benefits, and he could have used mail order medication and saved $250 by using that mail order. But it was very, very difficult to get to that bottom of that. And that is the problem that we face in our healthcare industry. How does a patient navigate our healthcare system, which is so convoluted and opaque? My journey in the entrepreneurial side has begun almost 25 years ago. I've started 3 other ventures prior to Zaki Point Health, and one of the pride moments of success I've had is I started a mobile ticketing company, where we basically were using a lot of the data, member profiles, member kind of understanding, location to phone numbers to everything, to actually target offers, get members engaged, and get them to use things like cinemas and coupons and tickets to festivals and things like that. And learned a lot that you can really do a lot more with these devices. And now with all the technology and AI, we believe there's a lot more to be done and should be done. So that's kind of what gets me fired up every morning. So that's about me.
Great. Thank you, Ramesh. Thanks a lot and welcome to the panel. It's really exciting to have you with us. Moving to Shane Cook, and he's the CEO of Ethiometry. Shane, would you mind giving us a small introduction and what brings you today to us?
Yeah, thanks, Amat. Appreciate the opportunity to speak here today. As you mentioned, I'm CEO of Ediometry. We have developed a clinical intelligence platform and that is in use in several hospitals throughout the world. This is a platform that we focus in the very complex high acuity units in the hospital and the ICU primarily, although we're branching out of that as well. Essentially aggregating all of the data in that ICU setting, utilizing our FDA cleared AI algorithms to produce additional insights and really guiding and helping the care teams in this complex environment with clinical decision making. I've been in the industry for 25 years now, hard to believe, a mix of medical device firms, both large and small, and over the last 10 years, executive roles in a couple of startups, a med device startup, and for the last 5 years here at Ediometry. So thanks for having me.
Absolutely, and most welcome. Looks like we all have 2 decades plus experience in the panel, so pretty good, pretty exciting. All right, I'd kick it off from my side of things, guys. So just to give a brief about digital health solutions. We've been talking about, our topic is all about digital health today. But what is it really? Just for in terms of layman terms, if I may have to explain to kick off the things, digital health today is changing the face of the way healthcare has been provided in the US. Absolutely, uh, in a very, very different way from what it used to be around 5 to 10 years back. And um, it all has to come down to one simple thing, which is technology. And technology has changed and it's evolving day by day by improving not just the cost of the care, but also the outcomes that we're expecting from the providers with the use of these technologies. And there are different, if when we talk about health solutions, it is kind of a broad level term or a phrase which covers a lot of different areas of technologies which I wanted to cover today. But this is not like a complete list. This is more like a small list of these solutions which kind of come under the compass of digital health solutions that are currently prevailing in the market, right from the patient care cycle. When, let's say, and God forbid, if something happens and you need to go to a care provider today, it starts from finding a doctor, to booking an appointment, to going to the clinic, filling up those forms, and then uh, the doctor or the provider seeing you and providing you with the care and talking to you, taking those consult notes, putting them into a software or a technology system, which is kind of the core of overall cycle of the care, to giving them the prescription, which automatically gets transferred to the pharmacies today. All this chain of cycle comes under the different technology solutions which form today the digital health solutions stream of solutions, that if I may. And at the core of it, every care provider today has some sort of a system or a software that they use, that's called as EHR, which is electronic health record system, which is the most basic system which everybody uses in their clinics, in the hospitals. It's a comprehensive tool which is used for 360 comprehensive view on the patient, not just from the care provider's perspective, but also from the patient's perspective as well. And a key component today, which has changed drastically in the few years, is the interoperability that was required between two EHRs. Now, with the advancement of technology, advancement of internet, it is now possible to for two EHRs or for two different systems to talk smoothly and seamlessly, which is where the technology is moving now. Second, which I want to mention, is AI. I think everybody has been talking about AI, and but now is a time which is very exciting, where people are seeing the real use of AI, right from finding a provider using a finding tool which is enabled by AI, to a few applications which are used by providers where they can now quickly take the notes by just speaking into the microphone, and that automatically gets converted into or transcribed into the notes which are understood by the EHR, and then also providing the summary to the payers or the insurance providers. All that can be done and is being automated using AI. And some of those examples we will also see from our panelists today as well. Smart devices. I think everybody's wearing one of those today. Um, I'm a diabetic, a fun fact, and I wear a CGM. That device, smart device, automatically collects the data. And today's capability with internet capability and advancement securely can provide all that data into tools like RPM, which is remote patient monitoring, where these data points can now be collected and monitored by the providers at sitting at their clinics, and they can keep an eye on how their patients are doing. Moving to decision support systems, which is again another section which we ourselves have also worked on, where using AI or other technologies, the care providers can take more better decisions, but with the help of AI and different support mechanisms that are now available with the help of technology. AR and VR, that's a game changer. Things are now moving towards, you can sit at the couch in your living room if you are sick and be on a virtual room, And we've built applications around it where you can be in the same room, not exposing your real self, but maybe create an avatar, and the provider can come in the same room and they can talk to you, maybe best for therapy, best for other sessions as well. So that's where the technology is going towards VR. VR is also heavily being used towards training these days, and this all is helping the overall health outcome for the patients. Telehealth, mHealth is another thing which is, I think, everybody is using today. That itself has almost reduced the cost of a visit by 45% in the country. So you can imagine the impact that health is getting impacted with the digital solutions that are being provided today. And over 75% in the provider space today are using AI. And as it said, we are just getting started in AI. AI is one of the most exciting technologies that we are seeing that I believe is going to change the way we live as humans as well. That being said, I think I just wanted to give a brief introduction about what digital health solutions do exist today in the market. As I said, this is not a comprehensive long list, but few key components or key technologies which are currently prevailing in the market. I would move the slide deck further and would invite my first panelist, Jonathan, to talk about his slides and what he would like to cover today. Jonathan, over to you, please.
Wonderful. So I'm going to give you some of the dark side of healthcare in the sense that everybody sees the high valuations, but they don't see that these companies are literally bleeding money, most of them. Some of them figured it out, and many of them have not, as denoted by this slide, as the valuations are great, but the Series D, E, Fs that you start to see means they haven't figured out product market fit. In my space, in the primary care space, the typical margins are between 5 and 15%. Not very much. And this is why these companies struggle to make money. And the only way they can do it is go very big or they go home. We all know One Medical that was acquired by Amazon. Everybody thinks that's a success story in a general sense. Their stock price in 2021 was actually $58, and they were acquired for 18 a year later. So to give you some context, that's typically how it's done because most companies haven't figured out the system in place in which to do this. One thing this also slide denotes is you have to have a lot of patients to make it worthwhile. You know, anywhere from 80,000 up to a few million patients to actually make money. Well, if you're acquiring the old way with a brick and mortar system, which is most of the companies are today, they actually have to buy office space or rent out buildings in New York and very high price locations. That's why their margins are so very low. When you start to couple in AI, and I'll go into more slides in depth on this and why it's beneficial, you can start to scale and deliver more care to more patients appropriately and save money doing so, and then reinvest those dollars back into other areas. One thing I'll touch on with our company versus others in the space are that these are all brick and mortar locations. They have to have real estate in very high priced, Los Angeles, New York locations. Where we come in, it's a little different. Something that other startups should think about is how do you partner with other health systems and provide care, but do it in a scalable format where you don't have to outlay the cost of building space, EHR access, software, insurance in the typical form. And so how we do it at a very high level, and I'll kind of dive in a little deeper later, is on the federally qualified health center market, we go in and offer our clinical services and all our technology free of charge. So you're like, well, how do you make money? Well, the good thing is we have reimbursement codes from the Medicare, Medicaid, and commercial plans that cover our cost. And then our partners, the federally qualified health centers, then cover all our cost on, they pay for the EHR, they give us free building space. While we're virtual, we can go physically in the building as well and treat patients in person. And along with all the other credentialing and billing teams and referral teams, they do all the heavy lifting on that side, on the operational side, where we provide all the clinical support and the technology. And the benefit is they make money with us, we give them money, and the government pays us as well. So it's a shareable approach. Very few businesses have that model. And if you can come up to a conclusion where you can offer that, you'll have more success. Feel free to flip to the next slide. So this is kind of the crutch of all this. And if you're familiar with fee-for-service, which is atrocious, but that's typically how most care delivery is performed, there are over 11 billion claims in the United States annually. representing about 11,000 CPT codes. And a CPT code is basically a reference to the encounter type that a provider offers to their patient. So for example, lung cancer screening in our case. Well, out of those 11,000 codes, 2,000 are radiology specific, and only 16 use AI today. And one thing you'll denote, and I'll focus on two areas on this slide, on this paper. On the left column, you'll see total claims. They're not being utilized. I'll give you context to why in a second. Second to that is the CPT codes column. You'll see they're all T codes except for one. And those are meaning they're temporary codes, meaning if you do a great job and you show Medicare, Medicaid, and commercial plans, you can actually provide care to your patients using these codes, then they'll make it a full-time code. Problem is, no one's using them yet because the fallacy of AI. Clinical AI is not being utilized today, meaning that these health systems, one thing is they don't trust AI yet clinically. There's no AI assurance, firewalls behind the scenes managing the output of these technologies. And these systems typically don't have the money and or the resources and or the staffing to run the technology. So how do you sell something to somebody that doesn't understand how to buy it? You don't. And so I don't want to put a back burner on everybody's hopes and dreams, but this is the case in healthcare. You have to start with reimbursement first. Figure out how to get reimbursed for your AI. Make sure you have an AI code first, and then go out to market and find a business model that shares risk with the providers you work with. If you don't have that, you're probably going to fail with all the other thousands of startups that come out every single year in this space. What's unique about Oatmeal is we have two CPT codes. We have a screening technology that pays us to screen patients for lung cancer. It's called an eligibility check. We use AI technology to scrub EHR data. Basically, we look at comorbidities, labs, images, vitals, medical history, you name it. And we pinpoint the patients that are highest risk and eligible for certain types of screenings. From that stage, then we run our diagnostic solution, which is another tool it's called computer vision. It actually analyzes a scan of the CT along with the original radiology report. Think of it as a second opinion. And we get paid an additional $650 for that. So we get paid $300 on the front end, $650 on the back end. Unfortunately, we have unlimited patients to help. So it's more about how fast we can scale. And that's where we're at today. We're actually raising a seed round. So if anybody's interested, I'll just throw it out there. Next slide, please.
Well, actually, this is for
Sure,
Ramesh.
I have more on
So
the back.
we'll come back to you, Jonathan, to talk more about
Absolutely.
your case studies and what you guys are trying to solve. But I must add to that, I think when I first heard that there are some CPT codes for AI, I was absolutely thrilled. I was not even knowing that there are some CPT codes available. So really, really amazing work that you're doing, Jonathan. Moving to Ramesh. Ramesh, I think a couple of slides from your side that you would like to cover from your end. Ramesh, are you there?
Yes, sorry. I want to shift gears to the other part, the other black hole in healthcare, around the whole healthcare administration, which is really what the patient is experiencing before they get into the healthcare system. They then obviously use the healthcare system, and then they deal with those bills afterwards as well. And so when you look at overall healthcare administration and then how that impacts costs, I'm going to share with you what self-funded employers are doing, which is basically these employers pay for their employee healthcare costs. Each claim is paid by the employer. They are taking the risk. They are not counting on Cigna or Aetna to actually pay for the bill. They're just administering it on behalf of those employers. Now, these self-funded employers are spending about $14,000 per employee per year, and 30% of that is wasted, mainly because the patients lack transparency. They don't know what things cost in our healthcare system. In fact, many of you on the call here probably don't know what an MRI costs close to your house, or if you went to two different places, what exactly the MRI cost will be. And because of that, there's a real lack of direction, and it's very hard to navigate. And then beyond that, healthcare is not really personalized for that patient when they're using it. And that is the tagline challenge. Now, what is underlying all of that in the healthcare administration? I want to set the context, which later on I'll share with you a case study. The rising healthcare costs, which the employers and the patients across the country are really concerned about. It's very hard to engage those members who are on these healthcare benefits because A lot of stuff is thrown at them. They have no idea which is a high quality, low cost place of care. What are the benefit programs are available to them? There's just quite a lot of those. So engaging is very hard. Navigating is even more challenging because now there's all this telemedicine or urgent care, or you've got instead of using ER, there's a whole bunch of things going on. How do you, as a patient, know what the right thing to do is, right thing to use is? So that whole navigation is problematic. And that also leads to this operational inefficiencies in the system where you cannot quite scale and share and support that patient across different employers and across different parts of the country. So there's a real operational inefficiency there. And these administrators are sitting on these mountains and mountains of data, but it's not clear how to gather insights from this, where the risks are, where the costs are, who's predicted to be high risk, who's predicted to go into the ER or hospitalization, or number of days they're going to spend, where the costs are people going to the right places of care, MRI, where the costs are low and quality is high, or other kind of commoditized items in healthcare. There's a lot of data out there, but it's in so many different silos that it's very hard to help the patient and help the plan sponsor to make meaning of it. Next slide. So that's the context of the problem. I want to share with you a framework that you could actually use in your whatever arenas you're thinking about. But when it comes to healthcare administration, we see these three levels of where AI can have tremendous impact. At the tip of it, which is really where it's the most exciting, what's going on is how do you engage that patient? How do you enhance their experience? And then how do you engage them, and how do you support them? It is going to be tremendously exciting. I've seen this, as I mentioned, in my mobile couponing world. We used to have 50 to 70% of the people on their mobile devices accessing these coupons, using them, and that data that was collected was actually really meaningful in re-engaging them. Now, this is 20 years ago. We were doing this on text messages. What is possible today with the data, if it is brought together properly and leveraging AI, you could actually enhance that member experience. So you're not having to, like, when something happens in your house, a healthcare need is there, you're not calling your friend or a neighbor, hey, what should I do? Where's a doctor for this? There should be a place where you can go and get this done, taken care of. The next layer is, how do you use all of this AI technology, the data, to predict risks, predict events, predict things that are happening around the corner, so that you can be more proactive in our healthcare system. Several years ago, 7-8 years ago, Target, did this news that came out that they were able to find somebody who is a teenager who is pregnant, and they sent the message to the dad. And the dad, like, what is going on? How is it possible that Target knows this situation? And became a big news. Now, with all the data that's out there, we should be actually using predictive analytics for far better reasons, where we can help the patient, we can help the system bring the right person into the picture. So that's where predictive analytics and doing that at scale could be really meaningful, leveraging even the CPT codes that we've talked about here. And the third base layer, which every business should be thinking about. I mean, if you are doing a marketing agency, you should be thinking about how you can use AI to improve margins, to improve operations. And in the healthcare space, there's too much of same thing done 8 to 10 times, repeated, like same forms are filled in 8 to 10 times. Same questionnaires are done 8 to 10 times. You're kind of going here to there, to there, to there. You can use AI for all variety of workflow pieces. And how do you use that to automate different aspects of healthcare administration and patient experience when you are going into the system? So that's kind of the three layers that you can really take from here and leverage and apply. We can move to the next slide.
Yeah, thank you, Ramesh. And I think I just wanted to add, AI has such a big impact. I remember the story. Very recently, I attended an event where the chief data officer and chief AI officer of Parkland Hospital System, which is a public healthcare system in Dallas, he told a very great case study that they have done where they have built a model where, on the basis of two drugs which are being prescribed by a provider, they have created a model which using historical data can predict whether these two drugs can go together or not, and it can kind of give a warning to the provider. And I found it really fascinating. Imagine the amount of errors and the insurance issues that it can really save, and that's already in use. And they've done some really amazing work. I just wanted to follow up on the AI thing that you just mentioned, Ramesh. Thank you. Thanks for that. Moving to ethiometry, moving to Shane. Shane, over to you.
Yeah, thank you. And I'll focus the discussion on a slightly different care setting here than certainly than what Jonathan had was speaking about, and really starting with the challenges that clinicians and administrators face, especially in the very complex ICU environment in a hospital. And I think all of us were aware of that, especially a few years back when COVID-19 hit, and just the challenges that hospitals face with resource constraints, with the burnout that clinicians face. And this is a very complex environment that has a tremendous amount of information overload, just given all of the data sources within that environment. Of course, the economic dynamics are different in the ICU than other care settings as well. The ICU does not make up the most number of beds in a hospital, but it contributes a substantial amount of the cost, given how complex and long lengths of stays these patients have. So information overload, cognitive burden are key issues. You can see in the picture here just how chaotic this can be in this environment to really see all of the data that is needed to care for a patient, looking at the longitudinal trends of these patients. And perhaps most importantly, it's very high stakes. There are narrow margins. These are the sickest of the sick patients in the hospital. And these challenges impact clinical outcomes, costs, quality metrics, and this setting is a natural fit for the benefit of data analytics and AI to be a force multiplier in this environment. That's really where we come in, which you see on the right side of this page with Ediometry. This is a web-based clinical intelligence platform that has been developed several years ago. It's been in the market for quite some time. We're growing rapidly in both adult and pediatric sites. We are aggregating data within this environment, pulling it into one visualization. On the top of that visualization, you see our FDA-cleared analytics, which are focused on physiologic risks, constantly trending to show the risk profile of the patient. That same AI algorithm can be used if it's trending towards a patient deteriorating to escalate care for that patient. Conversely, if it's showing more stable, you can use that, as clinicians do every day, to make de-escalation decisions. Can you start weaning that patient off of a ventilator or off of their vasoactive meds, getting them out of the ICU sooner? So really impacting those outcomes, helping the clinicians to with their clinical decision making is really what we're focused on doing. It's seamless. It's connected through single sign-on to the electronic health records as well. And what you see on the bottom right here are published outcomes. So this is one of the differentiators that we have in this market, is several clinical studies showing substantial outcomes improvement with reduction in ICU length of stay, reduction in readmissions to the ICU, less time on mechanical ventilation, less time on vasoactive support, and certainly a lot of engagement with nurses, respiratory therapists, and physicians to help streamline care and hopefully make their lives easier. So this is what we are focused on. It's, as mentioned, it's a very, very challenging environment in the ICU, and we work through our data and analytics platform to help make decisions far easier and far better for clinicians to make. So that's a little bit about us. As far as future trends and current trends in digital health that I see, when I think through the trends, I reflect on the many discussions I have with hospital executives and what is on their minds and what are they talking about. And what you see on the left side of this page is a schematic for the learning health system from the AHRQ. And this is a concept where a hospital or health system is generating their own data, using it to fuel research, which is continuously generating insights that they can funnel back into their practice to improve outcomes and impact their cost as well. This is what is on the mind of hospital executives, and especially deeper integration of technologies and new tools that are coming out every day to help these hospitals and health systems across the continuum of care improve their outcomes. Um, and so it's interesting. That's what I talk to them about often. And you can see on the right, this is a recent study from Deloitte, which very much confirms this. This is a 2025 study looking at the major trends that hospitals and health systems are thinking about as far as digital transformation, with accelerating that, with the adoption of virtual health and digital tools, some of which you heard today already. Generative AI, of course, is a major one, and frankly, we're seeing hospitals now hiring chief AI officers to assess these technologies. And finally, cyber attacks. So these are the key strategies that health systems are thinking about. And then the actions and the trends that they are taking towards those, you see on the right side of this page, very much a high focus on cybersecurity, and some of the ransomware attacks that you've seen over the last several years. Investing in technologies that can help, like ediometries, impact decision making, streamline care, streamline workflows, and make it easier. And ultimately, what we focus on is trying to get the clinicians back to doing what they do best, which is using their clinical judgment, helping them to enhance that, but getting back to treating the patient. And that's really our focus at Ediometry.
Thank you,
And
Shane. This
I'll share
was,
a case study of outcomes later on as well.
yeah, thank you. And I think this was an amazing slide, I must say. So nice to know what really the people in the care ecosystem are thinking and doing in terms of digital. So nice. That being said, so we moving on with the impact that we are all creating as entrepreneurs. I wanted to give one slide each to all the presenters to talk a little bit about direct or indirect impact that we all bring to the digital health ecosystem so that the audience understand how we are helping out in the overall support system that we have. Um, I'll go first. So talking about the the company that we have Jump Growth, which is providing product engineering services, digital product engineering services, and digital solutions. As Shane recently covered, that all the provider ecosystem is looking to modernize their systems and create more digital investments to move forward. These are just a few of the projects or of the work that we have done. We have done over 100 plus projects in healthcare because that's our prime focus. And we have experience in, when I talked earlier, I talked about EHR. So we have experience in talking and integrating with various EHR systems, including Athena, Epic, and eClinicWorks, which are Cerner, incidentally, we have not worked with, but those are four major EHR systems being used by the US care ecosystem as of today. We've done AI decision support systems where we built a platform for wound care providers to be able to choose the wound location and the intensity of the wound. And using a technical score of Brendan score and AI, it was supporting the care provider and providing what kind of appointments or what kind of prescriptions can the provider prescribe to the patient, and even can create a complete plan of care for the provider, which they can choose to modify or take action on. Then we work for a pain reduction device, which is more like an IoT device, and it's called DNA Vibe. We worked to build a mobile app. Using the mobile app, the users of the device can control the intensity and also record the feedback on how that device is helping them, which automatically gets connected to cloud and is shown to the manufacturing company on how really their device is impacting these patients on a day-to-day basis. As I said earlier, we've built a VR-based telehealth platform for a client in New York, using which now both the care providers and the patients can come together in a avatar-induced VR space and can talk freely and get the care and talk about what they're looking for. Um, Moving to, we've also worked with an urgent care, actually, it's a multi location urgent care ecosystem. We built an AI agent for them, which is used by providers in all these urgent cares to take voice notes, which are automatically getting transcribed and converted into synopsises, and key points from those notes are automatically generated using AI. Built that. Another different project that we've done that I'm very proud of is a transplant mobile application built for one of our clients in Dallas. And they are kind of creating an ecosystem, streamlining the application process of, let's say, if you need a transplant or if you are a donor. And so it overall is enhancing efficiency multifold and helping the people on a day to day basis. These are just a few examples that I wanted to bring up to touch on the topic of digital solutions and what we have done as a company and how we have impacted the overall ecosystem, humbly being very small part of that ecosystem and trying our best to achieve, that and help in the ecosystem wherever we can. Um, Moving to Oatmeal, they would like to share some success stories of what they are doing as well. So, Jonathan, over to you.
Wonderful. So I'm going to go through just a quick couple slides. We discussed this one a little bit. Wanted to show you how it actually all comes together. So in order to build a system for healthcare, you usually can't just build one little component. It needs to be actualized with both a physical person and some technology in most cases, unless you can sell the solution to people that already are used to using it. So in our case, we have the AI identification solution that identifies patients. We could technically sell that, but our partners don't have the capital or the resources to use it. So we decided to go in and hire our own nurse practitioners to apply our own technology to our own collective patients. The reason why we can do this, as we discussed before, is we have reimbursement for that actual call. For a 10-minute visit, we get paid between $150 to $300 to determine whether or not that patient is at risk, and then we help them get to the CT scanner location at a local imaging center or hospital. And then the second phase is where we apply our secondary algorithm, which I'll discuss in a second, which is an AI second opinion, which is about 20 to 30% better than the standard of care that a typical radiologist can visualize with their eyeballs. So if the current doctor or radiologist reviews something and misses something, we can catch it early enough to make a difference or impact with that patient's life. And then we continually do this every 3, 6, or 9 months on a cycle. And this is specifically for lung cancer, to ensure that patient, if it is not cancer today, but it is in the future, we catch it early, not only to impact the patient, but also save the health system an additional $250,000 in costs that are associated with late stage diagnosis, in which the case with lung cancer, 85% of the time, patients are diagnosed late stage, which is a really deplorable statistic. Next slide, please. Next slide. Oh, there we go. Thank you. So the challenge now is we started with our first major site in Oklahoma. It's the largest rural health system in the state with 35,000 patients in 10 locations. We applied our AI technology, which is think of it as an AI scrubber that looks at all the EHR data sets. We identified 5,600 patients that are eligible for the screening. Our nurses are now actively screening those patients and whittling down that list down to 0, and then repeating it year after year. We have a 95% engagement rate, meaning that once we get our patients on a call, then 95% of them show up to their CT scan, which is really high. Typical healthcare is like 10%, 10 to 20%. And next slide. The last slide, since we're talking about AI, I wanted to discuss this specifically. So while you remember the chart we showed you before, the 16 AI CPT codes. Typically, we would not be building our own, although we are an AI company as well. We're a hybrid clinical AI company. We would rather leverage what's already existing in the market. Problem is, no one built it yet. And so we're very fortunate that we had an amazing team of engineers that built it in 6 months. We're about to submit to the FDA for our 510K. We leveraged over 100,000 CT scans from 23,000 individual patients to create this. And the benefit to this is now we have a very high accuracy, sensitivity, specificity rate of 94%, which is above and beyond the standard of care, which is typically between 65 and 80% of a standard radiologist. So we're very fortunate that we have a team that can build these things out. But now, instead of selling this technology, we can actually apply it to our own patient population and help them live better lives. While we could sell it, we probably end up in the next year or two. We don't have to because we already have enough patients that we can apply it to generate that additional $650 CPT code. So I'll end it at, if you're an AI company building something, please do your research, find out how you get paid first, and then build it later. That will save you a heartache, and then many, many millions of dollars later, you'll go to market a lot faster than other companies that are doing it the opposite way. Thank you very much, you guys, and I am completed. Feel free to start the next speaker, please.
All right. Thank you, Jonathan. All right. Moving to Ramesh. Let's hear about Zaki Point Health. Yeah.
I thought a good way is to show what AI can do in healthcare administration and patient engagement. If I can share my screen and switch over. Is my screen sharing or no?
No, not yet. I think you should be able to. What I gather.
Okay, let me try one more time. It says it's sharing. Maybe you need to stop sharing or something so that people can see my screen.
I've stopped now. Can you try now?
Okay. Thank you. How about now? Thumbs up. Can people see my screen or no?
I don't think so. I cannot see it. No.
All right. Maybe we will leave it then. I'll try one more time, and otherwise I'll drop it.
Okay.
Let me try here one more time. No? Nothing coming through? Okay.
No, nothing coming through, Ramesh. I'm sorry for this. I'm
no
also
worries.
checking
Okay.
the settings, but I'm not seeing anything. Sorry.
No problem. You can bring the screen back. So what I was going to show you is the member experience, the patient experience that brings all the benefits in one place. And you have a picture of that on the right-hand side. What this really allows a member on their healthcare benefits is to do a variety of things. They are able to see their claims history, their EOBs, their ID cards, when they are going into the provider setting. It can show them all the providers that they have access to on their benefit plans. It shows them their real-time position on their deductibles, what plan they have. Where this gets most exciting, where we've seen great kind of engagement and numbers, are fundamentally two things, or I would say maybe I'll touch on the third thing, which is emerging. The two things really are, first is we have built this AI chatbot technology that takes all the benefit documents, takes the detailed claims history, takes the pharmacy history, takes the eligibility, social demographics of the person, builds these models at an individual member level, predicts their risks and costs and gaps in care. If they have a chronic condition, we use that identifier in the analytics to be able to see, does the member, they're diabetic, have they done HbA1c or have they have they done their eye exam, have they done their foot exam, and things like that. So some of the things using the claims history. So all of that is now, profile is available to the engine. And then the AI chatbot is able to help the member 24/7, 365 days a year, to be able to ask simple things like, where am I on my deductible? What's my cost for a PCP visit? Do I need to get a referral for a specialist visit? These are like 50 to 70% of the calls that the call center gets from these patients. This bot can take care of that. And these are transactional calls where it's really frustrating experience. Even person on the other side is spending some time trying to figure out, okay, log in here, log in there. And so if you take away this transactional interactions, now you have the license to engage the patient, where using machine learning, we are able to provide a lot more targeted personalization, which basically leads to these campaigns, which tells them, hey, I noticed you haven't done X in the last 12 months. Make your PCP appointment. Or we're using many of these behavioral science frameworks to see how a gain frame could actually get the member to take action. Like in the case of my dad, rationalist, wants to see savings. How do you use that profile to be able to tell a person, hey, you could actually save money on using mail order medication program, click here. So those are kind of the campaigns that we're seeing engagement rates of anywhere around 30 to 45%, which is much, much higher than what otherwise has been seeing in the market. So some of the examples of that over here, what it's allowing us to do is to address these 50-odd% benefit-related questions. It's allowing the call center teams, the care navigators, to have more of a relationship with the patient, and rather than transactional questions and answers, and be more empathetic with the situation and advise the member rather than having to like, oh, okay, here's your ID card. We're also seeing through that the CSRs are able to, they are happier, and their NPS scores are going up. We are seeing the AI bot today is reducing around 15% of the call length and call volume, which we anticipate going up to about 50-odd% over the next 3 years. So that's kind of the impact, and over a period of time, as we identify risks and costs, as we identify the where the member should go. And this is the third layer that I was sort of referring to, is we also are now using the pricing data and the quality data of the provider to be able to proactively steer the member to the high quality, low cost places of care, which will ultimately result in anywhere between 3 to 5% reduction in overall healthcare costs. For the members who are using it, obviously there's a tremendous drop in the MRI, which at one place might be $2,000, at another place it might be $700. So there's a big impact there, but in aggregate, we are seeing 3 to 5% savings could be achieved, or contained, the cost could be contained. So that's kind of the power of leveraging, bringing all of that data in one place, leveraging AI to support the member 24/7, and then really using that personalization engine to be able to constantly communicate with the member to help them navigate the system. So questions, please drop it in the chat. Happy to answer more, but that's kind of the case study I wanted to share with you.
Thank you, Ramesh. This was really helpful. Over to you, Shane.
Thank you. Yeah, and I wanted to share a case study really focused on the impact of our platform on real world data. And I think that one of the issues that I have seen, or perhaps disadvantages of just having so much discussion about AI and so many new tools coming out, I hear often that there's not a lot of data to support them yet, and it's building. But this goes into certainly hospitals' decisions on which technologies to look into. So I mentioned earlier when I covered what we do at Ediometry that we have several published studies, and that they come from automating workflows within the ICU environment around ventilation, around cardiac care, around other key disease states within the ICU. But this was actually a data analysis that we conducted with one of our current sites. where we looked at the impact on major outcomes such as ICU length of stay and ventilator days, both of which are major cost drivers for hospitals. And we looked at the impact pre ediometry's installation and post. And that's what you see here. So we looked at data for those two metrics 3 years before we were installed and then a year after. And you can see a clear acceleration of the downward trend of both ICU length of stay and ventilation day. And actually, the metrics here are about 20% ICU length of stay and a 26% vent day reduction post implementation of our platform, which is very consistent with our published studies. So I wanted to share this as a real world example. It is a case study. It's not a published study, but it does show the true impact of, in a very complex environment like the ICU, utilizing a clinical intelligence platform to streamline communication and really impact clinical decision making. It can have a major impact.
Thank you, Shane. And this was really amazing. I think what you guys are really doing a really amazing thing. So thanks a lot to all of you. I would like, it's already kind of we're going above the time, but we would love to take a few questions from the audience as they may feel like. So I would move to the questions and answers session. And I do see that the chat is bubbling up. So I can probably pick one, which was for Shane. And I think somebody's asking, to what extent is it possible to develop an aggregate risk profile of patients outside an ICU environment via RPM devices?
Yeah,
You want to
it's
cover
it's a
that?
great it's a great question, and the short answer is yes, and it's very much on our roadmap of what we are focused on as a company. To develop the risk and to feed the risk analytics that we have developed. Of course, the more data, the better. So as you see, remote patient monitoring devices, biosensors, so long as that data is available and networked and we can get it, that can drive our algorithms. And that's certainly a major focus for our forward-looking roadmap. Right now, we're focused primarily on the ICU and extending beyond that, but this is a major focus area for the company moving forward.
Interesting. Thank you, Shane. Ramesh, a question to you. The way you have kind of changed from the provider's perspective, sorry, from the perspective of the patient, are these chatbots that you have built, are these directly being used by the patients, or are these being provided by the insurance plans? Like, who is your payer in your case? Is that me as a patient, or
Yeah.
is that the insurance providers? How is that
Yeah,
technology being sold right now?
great question. It's basically provided to the employee on the healthcare benefit plans by the employer who's self-funded. And we basically sell through those insurance companies or third-party administrators who have all the data. And so the reason we have kind of focused on that approach to get to the patient or the members on a health benefit plan, because you need all of that data to train these models and to take care of these edge cases where I need to know exactly where you are on your deductible, your plan that you're on, which providers are in your network or out of network, what are the phone numbers of those places, what are the costs, the contractual costs and everything. So that's why it's focused at that level. But we can zoom out once this is really well used to be able to use other data to support more patients more broadly.
Okay. I wanted to kind of make it an open question to, I see that Jonathan had to leave, but maybe we can both cover in a way. In case you would like to touch upon the cybersecurity piece. Shane covered that it's one of the biggest item on the things in the minds of the care provider administration today. What kind of challenges do we see, and especially around AI getting so prevalent these days? How is cybersecurity being handled at these places, and what are you guys seeing from the angle of compliance, cybersecurity, data security, those kind of aspects in the digital technology realm of things? Maybe we can all cover that. If you would like to go first, Shane or Ramesh, please go ahead. Shane,
Okay,
you
I'll go
want
first.
to?
So,
Yeah, go ahead. Yeah.
so obviously, it's a really important matter to securitize the data, HIPAA laws, and other kind of things. I think every company that's working on these AI tools, they have to take it seriously, because the moment something goes wrong, people are going to pounce on that. And people are going to be like, look, you can't trust this. The AI is going rogue. Though the reality is sometimes the data gets stolen and used in kind of strange ways when there are more humans involved, because who knows, maybe there's a benefit there for stealing that data. But I think it's got to be taken seriously. And so companies are taking, there's lots of tools coming out there, different methods. There's SOC 2 compliance, there's high-tech compliance. And so there's a bunch of kind of regulations as well that you have to follow through, and you've got to take it seriously. That's all I can say.
Yeah, I largely agree. I think it is really around the regulations and compliance, like the ISO 27001 certification that we have for cybersecurity. I think it's critical for all companies to have that, and I think it's also critical for such as Idiometry's case, to work very closely within the security networks of our hospital partners, which we do every day. I think the other aspect of this, though, is cybersecurity being so important, as it should be, rightfully so, and all of the new technologies coming out, it does add time when you're talking to perhaps a new hospital or health system as part of their assessment of bringing on a new technology. It does lengthen the sales cycle, I would say, and I think it's appropriate to do so. But that is certainly some of the impact that we're seeing.
Yeah, and I would like to add to that, and I covered this topic in one of my previous webinars as well. I believe that also the fact that with AI being used more and more, there would be possibility of AI biasness which would come, and data biasness which would come. And I think that the compliances today, especially in US, are still not kind of there. I think there has to be some sort of regulatory body which should come in to put in some kind of compliances on there, which I believe we probably would see in the next few years specific to AI. And I think that should change a lot of things for all of us.
Mhm.
That being said, I do have a question from Christopher Hill. Thanks, Chris, for joining. He's one of our clients. Thank you, Chris. His question, if we are honest, we really aren't seeing sustainable physician-patient engagement at scale and necessary to sustain companies in this space. How and when does this pivot happen? If any of you want to take it up. It's more about physician-patient engagement and at scale. How do we change that? What's really happening, and when is that happening? Ramesh, you want to take it up? Because I think you have more patient.
So I'll share a little example. We've got a piece of our platform that is physician-facing, provider-facing, for them to be able to track their panel of patients, to engage with them, and to do the outreach. We found they were not using it. And I think there are two fundamental things driving this at the moment. One is the doctors are just so busy. They are exhausted. They are spending, as it is, very little time maybe with the patient. There's a lot of basic EMR stuff that they have to do, and administrative things they have to do, and other things that to add another portal where they have to kind of see and how they engage the patient is just like, look, it's not my problem, or I just don't have time. The other is there's no real incentive at the end of the day. They are working on a fee-for-service model. The patient comes in, and that's where they are kind of taking care of the patient, and they want the best for the patient. But once the patient leaves, it's not really in their domain to kind of make sure that patient is out of the clinic and doesn't come back. And so we've kind of seen okay, unless some of the payment models are changing, and then, engaging patients and keeping them out of those settings is actually more of an incentive, that you might use certainly tools like ours. I don't know about other tools, obviously, but tools like ours that are driving engagement. So that would be my thoughts.
Oh, thank you, Ramesh, and thanks, Shane. I believe he
Yeah,
has
and
to
apologies.
drop
Yeah,
off
I
as
do
well.
have
I
to
think
drop
no,
off,
no
but thanks
worries.
for
We're
having me.
almost running late as well. I'll just take the last question. Kevin is asking me, so I can probably take that up. He's asking about EHR interoperability that we are seeing. So it's a big challenge, I know. Um, what we have seen is with a lot of advancement in technology and protocols like HL7 and EDIs and web services of the world. Now it is getting more and more efficient to transfer data between one system to the other securely and safely, which was not possible earlier. And there were a lot of challenges about HIPAA and PHI, and But when you talk about two secure systems exchanging the data using secure mechanisms, it is now getting possible, and things are getting more operable. Of course, there can be always more interoperability, but things are much better now. We've ourselves integrated multiple newer applications with these EHR software, or talking between two EHR software using a middleware in between. So those things are improving as we speak and as we move forward in the ecosystem. And for further details, we can definitely talk about, you can hit me up and we can take it from there. That being said, I think we're already 10 minutes beyond our point, and thanks a lot, everybody, to join on today's webinar. And I hope you found it valuable. I really enjoyed it myself. Thanks a lot. And small shameless hook, if you would like to discuss anything about product engineering or any kind of product development, feel free to scan this code. We would love to have a small free 2 hour requirements workshop with you, and would love to take you on what we can do for you. And these are the contact details of all our presenters on one slide. If you would like to directly hit us up, please feel free to send an email, and we would love to answer you whenever you have any questions. Once again, thank you. Thanks everybody to join the call, and especially thanks to all our presenters today. We would send the recording to everyone in case who have not joined also, they will be also sent the recording. And of course, all the people who have joined, they will be getting the recording as well. So thanks a lot, guys. Have a good one. I hope that I will see you again in the next webinar, which will be happening in the next quarter. We will send the details on LinkedIn. So please stay on a lookout for that. And thank you once again. Bye bye.